Megan, how is IMO Health, working with organizations? Can you share a real world example with us?
Certainly. One that came to mind whenever you talked about, a real life example where we were able to make that, impact on the financial bottom line by using data is where we collaborated with customers, health systems in order to do analyses on their denial data. And so that we could really pinpoint the actual source of a lot of these denials and actually be able to track that then all the way back to where that was occurring in the workflow. And so by doing that through data analytics, we were able to provide a very targeted and tailored solution that has allowed hospitals to see about a 10 times annualized ROI based off of what the success they've seen after putting that into place. So that was where data analytics helped us inform the most effective solution.
And
Wow,
Maria,
that's great.
I was just going to say, Maria, I might jump in just as Megan, made that comment. I think that, the idea of it's getting harder and harder for providers, right, with all of the things that are thrown at providers from a payer perspective. And having that analytics, right, to really be able to go to our care teams and help them identify how diagnosis coding has an impact, how workflows are having an impact, et cetera. And it really is impactful, I think, in terms of having that information to really work with our teams to make sure that we can avoid those denials by actually doing it the way the payers want to on the front end. It changes daily.